Hi, my name is Sylvia Groth and I'm a glaucoma specialist and clinician researcher at Vanderbilt University Medical Center in Nashville, Tennessee. Glaucoma is a progressive, degenerative disease of the optic nerve. If not diagnosed early, it can lead to irreversible blindness. Glaucoma disproportionately affects racial minorities such as African Americans and Latino. In 2020, there was an estimated 80 million people worldwide that had glaucoma. As the population ages, this is expected to increase to around 110 million by 2040. Glaucoma is often referred to as the silent thief of sight because it progresses unnoticed into blindness without the patients being aware until the end. My research involves evaluating methods to facilitate access to eye care for vulnerable patients by utilizing portable home devices. This therefore expands the reach of eye doctors to homebound, rural, and other populations that face barriers to seeking out eye care. During COVID-19 pandemic, we as physicians found ourselves unable to offer care to some of our patients. As a result, we had to cancel many appointments that were deemed non-urgent, and we pivoted patients to telemedicine when feasible. Many patients with progressive eye diseases are part of vulnerable populations such as the elderly and those with other conditions such as diabetes, heart disease, cancer, and obesity. These patients were therefore too high risk to bring into clinic. While our faculty conducted thousands of telemedicine visits, we found that many portions of our eye examinations could not be performed via telemedicine. In ophthalmology, we rely on several components of the exam to diagnose and monitor eye diseases. At present, many parts of the eye exam require in-person evaluation. Specifically, as a glaucoma specialist, I rely on acquiring a measurement of intraocular pressure, which is a vital sign to determine if glaucoma is progressing or remaining stable. In addition, visual field testing, or mapping out of the peripheral vision, provides valuable information on the disease status. These tests require specific equipment that typically reside as large, stationary machines in the clinic. Technologic developments have yielded devices that are now portable and able to be utilized outside the clinic setting. The purpose of my research has been to develop a process whereby these tools can be delivered to a patient's home, used by the patient for self-assessment, and returned in a timely manner to the treating physician for interpretation and either confirmation or alteration of care. Implementation of a suitable delivery and monitoring system could revolutionize ophthalmic care at a time when our aging population could be greatly served by receiving much of their care in their home environment. This could be particularly valuable in groups such as the elderly, homebound, rural, and minority populations. I am hopeful that these future advances will help reduce the burden of preventable vision loss in our patients in greatest need.